Mr. and Mrs. Nguyen are a 30-year-old Vietnamese couple who are expecting their first child soon. The baby is a girl. The couple are Vietnamese Americans whose parents immigrated to the United States with cousins already in the U.S. around 1979 following the implementation of the Orderly Departure Plan, which allowed the Vietnamese to join family members who had already immigrated to live legally without fear of being deported back to Vietnam. This followed the end of the war in Vietnam in 1975. The couple both speak English, but their primary language is Vietnamese.
When caring for Mrs. Nguyen, it is important to communicate in a way that is respectful towards her culture. Within Vietnamese culture, a laugh or a smile may not always be a positive thing. They will often laugh in inappropriate situations because they use it as a reflection that there is disharmony or conflict. So if you were to tell Mrs. Nguyen bad news about her baby and she laughs, don't automatically think she doesn't care. She likely does, but that is her way of coping with the situation. Eye contact is something that is deemed disrespectful in Vietnamese culture. If Mrs. Nguyen is not looking into your eyes while you're talking, she's being what she views as respectful, not disrespectful, which is contrary to our beliefs. When speaking to Mrs. Nguyen about any discomfort she may be having, it is unlikely that she'll speak up and share what is bothering her, since expressing discomfort is something that is seen as a weakness within her culture. So it's very important to pay close attention to her body language when caring for her. Vietnamese also values privacy. So that is another reason that she may not be quick to tell you what is wrong with her. Verbal communication is not something that holds as much importance within the Vietnamese culture, since they're taught from a very young age to think very hard before they speak. So they're very likely to be quiet. Vietnamese people find it extremely important to maintain harmony, so they will not be quick to start conflict, and they will rarely ever use blunt yes or no answers to questions. Their true thoughts and feelings are not as important as maintaining harmony, so again, when caring for Mrs. Nguyen, pay close attention to her body language. For Mrs. Nguyen, it may be a good idea to try and give her primarily female healthcare workers, since the Vietnamese culture is pretty modest. Touch is something that needs to be paid close attention to in order to show respect towards Mrs. Nguyen. The two most important places on her body to get permission before touching are her head and her vagina. Since she is pregnant, vaginal inspection will be part of her regular care, so it's important to ask if that is okay with her before doing so. The head is viewed as a sacred area of the body, so be aware of that, and also ask her if she would be okay with you touching the baby's head when she is giving birth, or if she wants you to do your best to avoid it altogether. And whatever she wants, try to respect that. Personal space is also valued in this culture, so do your best to give it to them so you do not make them uncomfortable, and also don't take it offensively if they're standing farther away from you than you're used to. When it comes to appointments, make sure you explain to her the importance of time in the United States. Her culture does not value time as much as we do, so she'll likely not stick to the time set up if that is not explained to her, since the Vietnamese people are much more relaxed about time. The main things that are seen as disrespectful are basically anything involving the feet, like placing them up on a desk, handing people things with only one hand, and touching without permission. United States culture and Vietnamese culture share many differences within their communication styles, so in order to provide the best care for your patient, try respecting their culture instead of making them respect yours.
In Vietnamese culture, it is common to find multiple generations living within the same house as to help provide care to one another. The decision making is primarily done by the father, but the elders are also highly regarded and involved in the decision making because they are considered wise and knowledgeable. While giving care to the Nguyen's, it could put Mrs. Nguyen at ease to involve the elders in the decision making. Roles within the household are divided among all family members. A typical Vietnamese marriage involves the husband making most of the income while the wife oversees the household and preparations. However, in America, roles may be reversed because it is easier to find jobs for women and teenagers that do not have education requirements. Divorce is not popular among the Vietnamese culture, but it isn't forbidden. Also, Vietnamese women provide for the needs and comforts of a family member who may become ill because they are considered more caring. Children are expected to help around the house and provide assistance to the older members of the household. Children are highly esteemed in Vietnamese culture because they can carry on the family line. Children are expected to please their parents and honor their decisions while also speaking highly of them after the parents' passing to their own children. Boys are expected to carry on the cultures and traditions of their family and enable their children to pass that down to future generations as well. Education is extremely valuable to parents for the success of their children. Typical start age of education is at the age of 6. Teachers are well respected and held in high esteem in the Vietnamese culture. Vietnamese women used to not go to healthcare facilities while pregnant unless there was complications regarding the pregnancy. Recently, the Vietnamese women have been going to professionals because of the improvement in information on the importance of clinics as well as the better accessibility of healthcare places. Pregnant women may look at positive things such as a happy picture to allow for a successful pregnancy. As a healthcare provider, we can suggest looking at a photo album with good memories for Mrs. Nguyen. During labor, it is very important to keep the women clean and maintain hygiene, which is a role that we as nurses can provide by taking time to improve hygiene for Mrs. Nguyen. The female family members are often play a large role in helping with the pregnancy and during the birth, while the father may not be as involved. The women rely on each other for support throughout the pregnancy and delivery. While caring for Mrs. Nguyen, we can encourage the family involvement of female members. Vietnamese women prefer a natural birth, but in dire situations, a cesarean birth is acceptable. They are accustomed to lying, supine, or squatting method when in labor. We can ask Mrs. Kim Nguyen which birthing position she would prefer to allow for the most comfort. Typically, circumcision is unwanted for a child unless a healthcare professional recommends it, but Mrs. Nguyen doesn't have to make that decision now because she's having a baby girl.
Along with other cultures in the world, the Vietnamese culture places a high value on healthcare practices and beliefs, and it varies when it comes to implementing those practices. When a member of the Nguyen family becomes sick, he or she will try to regain health by using home remedies before seeking professional medical care. For example, a remedy for sickness and cold symptoms is zong, which involves vapor rub to be boiled and inhaled by the individual to encourage opening of the airways. Regarding healthcare providers, Mr. Nguyen should always be greeted with a handshake, and Mrs. Nguyen should only receive a handshake when she initiates it. It is very important to not look her directly in the eyes, because it is seen as a sign of disrespect. A female physician should always be available to discuss any private matters that Mrs. Nguyen has, specifically those regarding the birth of her child, or any future questions about contraception and sex. These topics are commonly desired to be spoken about in the absence of men. If Mrs. Nguyen is uncomfortable with her husband in the room, instead of focusing on communicating with the nurse, she will begin to giggle and divert her attention away from the male to show she desires a more individualized conversation. While home remedies are acceptable forms of treatment for an illness, blood transfusions and organ donation have been ruled by the Vietnamese culture as unacceptable because of the widespread belief that the body is sacred and should remain together through both life and death. If anything were to go wrong during Mrs. Nguyen's pregnancy and she is unable to speak for herself, then her husband would be legally in charge of her medical care decisions. When the child is older and if both parents were to pass away, then the medical decisions in the family would be the responsibility of her being the firstborn child. If Kim and Jim's child were to be born with a mental illness, this diagnosis would not be treated lightly. The child would be hidden from the public within the family and treated as if she was a crazy person. They feel that when a person visits a psychiatrist, they are going to see someone who treats crazy people, and having a crazy person in the family can be seen as a sign of disgrace and shame to the family.
During my time caring for Mrs. Nguyen, we discussed many different options to relieve her neuropathic pain due to type 1 diabetes. I discovered that Mrs. Nguyen is part of the Buddhist religion, which is one of the two major religions in Vietnam. Buddhism and Catholicism are the two major religions. And one thing we talked about to relieve pain was meditation. Meditation is used in many Buddhist cultures and religions to just clear their minds, relieve stress. It can be used for pain as well. This is something newer in American culture to be incorporated, but she was very familiar with this, and Vietnamese people also like to minimize the amount of medications they're taking, especially pain medications. So this seemed like the best option for us to use, and it also incorporated her religion and spirituality. So it seemed like just relieving pain and getting that in, just a bonus. This is something she can do throughout the day. It just takes a couple minutes. She already had knowledge of meditation, but I kind of went through a couple things with her just so she knew what I was talking about, so we were on the same page. So I kind of just told her, take a deep breath in and hold it for a few seconds and then let it out. And it also helps to close your eyes, be maybe in a dark room, and reduce noise, surrounding noises, so just a quiet place. And with Mrs. Wen being pregnant, we also discussed meditation being used in the delivery room, kind of just to reduce pain from contractions, because she is hoping to do a natural birth and would like to minimize the amount of medications being used. Pain in Vietnamese culture is very hard to identify because many Vietnamese do not express pain due to seen as being a weakness. So you really have to look at your patient holistically, look at their facial expressions, body movements, anything like that. Meditation was a great option for Mrs. Wen, again, because it uses her religion, spirituality, and when she doesn't want to express the pain to me or others, she can kind of just use meditation as, if she wants to hide it as her religion, she can do that too without letting people know she's in pain. This seemed like the best option for us, and it has been working out great so far.
Food and nutrition within the Vietnamese culture is very important. They eat 3 meals a day as well, and they often eat with chopsticks. And they usually eat with their bowl or plate in hand because it can be seen as lazy if you don't. And then also it's disrespectful not to eat everything within your individual plate or bowl. They often eat really close to the ground, so if you eat out in Vietnam, the stools are really short, or they will eat on bamboo mats. And then there's 2 types of consistencies. There's either hot or cold, and that does not refer to the temperature of the food, but rather the spice of the food. So cold foods are rice, flour-based foods, and plants and fruit, whereas warm or hot food is your meats, your eggs, your peppers, more spicy type food. So Vietnamese will often choose hot consistency foods, especially after childbirth or surgery, because they see these types of foods as having healing properties and will restore you back to original strength. So in Kim's defense, she'd probably choose the hotter consistency foods since she's about to deliver this baby and she wants healing foods. So pregnant women begin to adjust their diets depending on which trimester of pregnancy they are in. So during the first trimester, they are deemed in a weaker state, so they're going to eat the hotter foods because they believe these foods will provide nutrients and good things to the fetus. And then during the second trimester, they're more in a neutral state, so they can go ahead and eat those colder foods. But then right before they're going to have their baby in that third trimester, females will enjoy the hotter foods. But rice, fruits, veggies, and certain meats and fish are all safe options for a woman who is pregnant in Vietnamese culture. One consideration to be wary about is that the Vietnamese diet can be very high in sodium, and then it can also lack calcium and fiber. So just knowing that as a nurse and helping to decide what are the best options for that Vietnamese client to be eating to make sure that their calcium and fiber levels are heightened and the sodium intake's a little bit backed off of. So for obvious reasons, Kim's going to want to monitor her diabetes, especially during her pregnancy, and just pay really close attention to the carbohydrates and the sugar that she takes in. So knowing as a nurse that you need to be there to help her with that. And then also one very big tradition that Vietnamese culture celebrates is Tet. It basically celebrates the Lunar New Year. So they just have a big festival with holiday food that is prepared for this Tet, and it often occurs late January, early February each year.